12 terrifying warning signs of brain cancer you can't ignore. Brain cancer can manifest in various ways, and recognizing the warning signs is crucial for early detection and treatment. While these symptoms can also be caused by other conditions, it's essential to consult a healthcare professional if you experience any of the following. 1. Headaches. Persistent or worsening headaches, especially if they are accompanied by other symptoms such as nausea, vomiting, or changes in vision. Headaches are a common symptom experienced by many individuals and can arise from various causes. While occasional headaches are generally considered normal and may result from factors such as stress, dehydration, or lack of sleep, persistent or severe headaches may indicate underlying health issues that warrant further evaluation. There are several types of headaches, each with its own characteristics and potential causes. Tension headaches, for example, are often described as a dull, achy sensation that affects both sides of the head and may be triggered by stress, poor posture, or muscle tension. Migraine headaches, on the other hand, are typically more severe and may be accompanied by symptoms such as nausea, vomiting, sensitivity to light or sound, and visual disturbances. Cluster headaches are characterized by intense, stabbing pain that tends to occur on one side of the head and may be associated with eye redness, tearing, or nasal congestion. In some cases, headaches may be a symptom of an underlying medical condition, such as high blood pressure, sinus infection, brain tumor, or neurological disorder. It's essential to pay attention to the characteristics of headaches, including their frequency, severity, duration, and associated symptoms, as well as any factors that trigger or worsen them. If you experience persistent or severe headaches, especially if they are accompanied by other concerning symptoms such as changes in vision, difficulty speaking, weakness, numbness, or confusion, it's crucial to seek medical attention promptly. A healthcare professional can perform a thorough evaluation, including a physical examination, medical history review, and diagnostic tests if necessary, to determine the underlying cause of the headaches and develop an appropriate treatment plan. Management of headaches may involve lifestyle modifications, such as stress management techniques, adequate hydration, regular exercise, and healthy sleep habits. Over-the-counter or prescription medications may also be recommended to alleviate pain or prevent headaches, depending on the underlying cause and severity of symptoms. Additionally, addressing any underlying medical conditions or triggers is essential for long-term management and prevention of headaches. Overall, understanding the potential causes and characteristics of headaches and seeking timely medical evaluation when needed are crucial steps in managing this common symptom and maintaining overall health and well-being. 2. Seizures, sudden or unexplained seizures, which may involve convulsions, muscle spasms, or loss of consciousness. Seizures, or epileptic episodes, are neurological events characterized by sudden, uncontrolled electrical activity in the brain. They can manifest in various ways, ranging from subtle changes in consciousness or sensation to convulsions and loss of awareness. Understanding the underlying mechanisms and potential triggers of seizures is crucial for effective management and treatment. Seizures occur when there is a disruption in the normal electrical activity of the brain, leading to abnormal bursts of neuron firing. This can result from various factors, including genetic predisposition, brain injury, infection, tumor, stroke, metabolic imbalance, or structural abnormalities in the brain. In some cases, the exact cause of seizures may not be identified, leading to a diagnosis of epilepsy, a chronic neurological disorder characterized by recurrent seizures. Seizures can manifest in different forms, depending on the areas of the brain affected and the severity of the electrical disturbance. Generalized seizures involve widespread electrical activity and may result in loss of consciousness, muscle rigidity, convulsions, or involuntary movements. Focal seizures, also known as partial seizures, originate in a specific area of the brain and may cause localized symptoms such as sensory changes, twitching, or repetitive movements. Triggers for seizures vary among individuals and may include factors such as stress, lack of sleep, flashing lights, alcohol or drug use, hormonal changes, or missed medication doses in individuals with epilepsy. Identifying and avoiding triggers can help reduce the risk of seizure recurrence and improve overall seizure control. Management of seizures often involves a combination of medical treatment, lifestyle modifications, and seizure management strategies. Antiepileptic medications are commonly prescribed to reduce the frequency and severity of seizures by stabilizing electrical activity in the brain. In some cases, surgical intervention or other non-pharmacological treatments may be recommended to address underlying structural abnormalities or improve seizure control. Additionally, lifestyle modifications such as maintaining a regular sleep schedule, managing stress, avoiding known triggers, and adhering to medication regimens are essential for seizure management. For individuals with epilepsy, maintaining open communication with healthcare providers, adhering to treatment plans, and seeking prompt medical attention for any changes in seizure activity or medication side effects are critical for optimal seizure control and overall well-being. Overall, understanding the underlying mechanisms and potential triggers of seizures, along with implementing appropriate management strategies, is essential for individuals with epilepsy and other seizure disorders to achieve optimal seizure control and quality of life. 3. Cognitive changes, difficulty concentrating, memory problems, confusion, or changes in thinking abilities. Changes in cognition, or cognitive impairment, can be a challenging aspect of living with brain cancer. As the disease progresses, individuals may experience various cognitive changes that can affect memory, attention, language, executive function, and overall mental processing. Understanding the underlying mechanisms and potential impact of cognitive impairment in brain cancer patients is crucial for providing appropriate support and optimizing quality of life. Brain cancer can directly affect cognitive function through several mechanisms, including tumor growth and infiltration into areas of the brain responsible for cognition, compression of surrounding brain tissue, disruption of neural networks, and treatment-related factors such as surgery, radiation therapy, or chemotherapy. Tumors located in specific areas of the brain, such as the frontal or temporal lobes, may have a more pronounced impact on cognition due to their role in higher-order cognitive processes. Cognitive impairment in brain cancer patients can manifest in various ways, depending on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing cognitive abilities. Common cognitive changes may include difficulty concentrating, memory problems, confusion, language difficulties, impaired judgment, and changes in personality or behavior. These changes can significantly impact daily functioning, work, relationships, and overall quality of life for patients and their caregivers. In addition to direct effects of the tumor, cognitive impairment in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as fatigue, nausea, pain, or cognitive fog, which may exacerbate existing cognitive difficulties or lead to new cognitive challenges. Managing cognitive impairment in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, oncologists, neuropsychologists, rehabilitation specialists, and supportive care providers. Treatment strategies may include symptom management, cognitive rehabilitation, psychoeducation, supportive therapies, and psychosocial support for patients and their families. Cognitive rehabilitation programs aim to address specific cognitive deficits and improve functional abilities through techniques such as cognitive exercises, compensatory strategies, memory aids, and psychoeducation. These programs can help patients learn to cope with cognitive changes, maximize remaining cognitive strengths, and adapt to new ways of thinking and functioning. Overall, understanding the complex interplay between brain cancer and cognitive function is essential for providing comprehensive care and support to patients and their families. By addressing cognitive impairment through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. For vision changes, blurred vision, double vision, or loss of peripheral vision. Changes in vision can be a significant concern for individuals diagnosed with brain cancer. The brain plays a crucial role in processing visual information received from the eyes, and any disruption to the brain's function can result in various visual disturbances. Understanding the underlying mechanisms and potential impact of changes in vision in brain cancer patients is essential for providing appropriate care and support. Brain cancer can affect vision through several mechanisms, including direct compression or infiltration of the optic nerve, optic chiasm, or visual processing areas of the brain. Tumors located near these structures can exert pressure on them, leading to visual impairment. Additionally, tumors may cause swelling or inflammation in the brain, disrupting the transmission of visual signals and causing changes in vision. The specific visual disturbances experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing visual function. Common visual changes may include blurred vision, double vision, diplopia, loss of peripheral vision, visual field loss, visual hallucinations, or difficulty with depth perception. In some cases, patients may also experience changes in color perception or light sensitivity. In addition to direct effects of the tumor, changes in vision in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as swelling, inflammation, or damage to surrounding brain tissue, further exacerbating visual disturbances or leading to new visual problems. Managing changes in vision in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neurosurgeons, ophthalmologists, oncologists, and supportive care providers. Treatment strategies may include symptom management, vision rehabilitation, supportive therapies, and psychosocial support for patients and their families. Vision rehabilitation programs aim to address specific visual deficits and improve functional abilities through techniques such as visual exercises, adaptive strategies, low vision aids, and psychoeducation. These programs can help patients learn to cope with visual changes, maximize remaining visual function, and adapt to new ways of seeing and interacting with their environment. Overall, understanding the complex relationship between brain cancer and changes in vision is crucial for providing comprehensive care and support to patients and their families. By addressing visual disturbances through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 5. Balance and coordination problems, difficulty walking, dizziness, vertigo, or clumsiness. Loss of balance, or imbalance, can be a distressing symptom experienced by individuals with brain cancer. The ability to maintain balance and coordination is essential for everyday activities such as walking, standing, and performing tasks requiring motor skills. Understanding the underlying mechanisms and potential impact of balance disturbances in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can affect balance and coordination through several mechanisms, including direct compression or infiltration of areas of the brain responsible for balance, coordination, and motor function. Tumors located in the cerebellum, brainstem, or other critical areas involved in balance control can disrupt neural circuits and impair motor coordination. Additionally, tumors may cause swelling, inflammation, or damage to surrounding brain tissue, further exacerbating balance disturbances. The specific balance problems experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing motor function. Common balance disturbances may include dizziness, vertigo, a sensation of spinning or whirling, unsteadiness, gait instability, or difficulty maintaining posture. Patients may also experience falls or difficulty with activities requiring precise motor control. In addition to direct effects of the tumor, balance disturbances in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as weakness, fatigue, neuropathy, or cognitive changes, further exacerbating balance problems or leading to new motor deficits. Managing balance disturbances in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neurosurgeons, physical therapists, occupational therapists, and supportive care providers. Treatment strategies may include symptom management, physical rehabilitation, assistive devices, and psychosocial support for patients and their families. Physical rehabilitation programs aim to address specific motor deficits and improve functional abilities through techniques such as balance exercises, gait training, muscle strengthening, and coordination exercises. These programs can help patients regain or maintain independence, reduce the risk of falls, and improve overall quality of life. Overall, understanding the complex relationship between brain cancer and balance disturbances is crucial for providing comprehensive care and support to patients and their families. By addressing balance problems through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 6. Weakness or numbness. Weakness or numbness in one side of the body, facial drooping, or difficulty moving limbs. Weakness or numbness can be distressing symptoms experienced by individuals with brain cancer. These sensations can affect various parts of the body and are often indicative of underlying neurological dysfunction. Understanding the underlying mechanisms and potential impact of weakness or numbness in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can cause weakness or numbness through several mechanisms, including direct compression or infiltration of areas of the brain responsible for motor function or sensory perception. Tumors located in specific regions of the brain, such as the motor cortex or sensory cortex, can exert pressure on or disrupt neural pathways, leading to weakness or numbness in corresponding parts of the body. Additionally, tumors may cause swelling, inflammation, or damage to surrounding brain tissue, further exacerbating neurological symptoms. The specific areas of weakness or numbness experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing neurological function. Common manifestations may include weakness or numbness in one side of the body, hemiparesis or hemiplegia, weakness or numbness in specific limbs or muscle groups, or generalized weakness affecting multiple areas of the body. In addition to direct effects of the tumor, weakness or numbness in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as fatigue, muscle weakness, peripheral neuropathy, or cognitive changes, further exacerbating neurological symptoms or leading to new motor deficits. Managing weakness or numbness in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neurosurgeons, physical therapists, occupational therapists, and supportive care providers. Treatment strategies may include symptom management, physical rehabilitation, assistive devices, and psychosocial support for patients and their families. Physical rehabilitation programs aim to address specific motor deficits and improve functional abilities through techniques such as muscle strengthening, range of motion exercises, coordination exercises, and adaptive strategies. These programs can help patients regain or maintain independence, improve quality of life, and optimize overall functioning. Overall, understanding the complex relationship between brain cancer and weakness or numbness is crucial for providing comprehensive care and support to patients and their families. By addressing neurological symptoms through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 7. Speech difficulties, slurred speech, difficulty finding words, or trouble articulating thoughts. Difficulty with speech, or speech impairment, can be a challenging symptom experienced by individuals with brain cancer. The ability to communicate effectively is essential for expressing thoughts, emotions, and needs, and any disruption to speech function can significantly impact daily interactions and quality of life. Understanding the underlying mechanisms and potential impact of speech difficulties in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can affect speech through several mechanisms, including direct compression or infiltration of areas of the brain responsible for language processing and production. Tumors located in language areas such as Broca's area or Wernicke's area can disrupt neural circuits involved in speech production, comprehension, or articulation, leading to speech difficulties. Additionally, tumors may cause swelling, inflammation, or damage to surrounding brain tissue, further exacerbating speech impairment. The specific speech difficulties experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing language abilities. Common manifestations may include difficulty finding words, anomia, slurred speech, impaired fluency or rhythm, dysarthria, difficulty understanding or processing language, aphasia, or changes in voice quality. In addition to direct effects of the tumor, speech difficulties in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as fatigue, weakness, cognitive changes, or mucositis, further exacerbating speech problems or leading to new language deficits. Managing speech difficulties in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neurosurgeons, speech-language pathologists, oncologists, and supportive care providers. Treatment strategies may include speech therapy, augmentative and alternative communication, AAC, devices, compensatory strategies, and psychosocial support for patients and their families. Speech therapy aims to address specific speech and language deficits and improve functional communication abilities through techniques such as articulation exercises, language drills, cognitive linguistic tasks, and voice therapy. These interventions can help patients regain or maintain communication skills, enhance social interactions, and improve overall quality of life. Overall, understanding the complex relationship between brain cancer and speech difficulties is crucial for providing comprehensive care and support to patients and their families. By addressing communication challenges through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 8. Personality or behavior changes, mood swings, irritability, aggression, or changes in personality. Changes in personality or behavior can be significant and distressing symptoms experienced by individuals with brain cancer. The brain plays a crucial role in regulating emotions, personality traits, and behavioral responses, and any disruption to brain function can lead to alterations in these domains. Understanding the underlying mechanisms and potential impact of personality or behavioral changes in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can affect personality and behavior through several mechanisms, including direct infiltration or compression of areas of the brain involved in emotional regulation, impulse control, and social cognition. Tumors located in regions such as the frontal lobes, limbic system, or prefrontal cortex can disrupt neural circuits responsible for personality traits, mood regulation, and decision-making, leading to changes in behavior or emotional expression. Additionally, tumors may cause swelling, inflammation, or damage to surrounding brain tissue, further exacerbating personality or behavioral disturbances. The specific changes in personality or behavior experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing psychological functioning. Common manifestations may include alterations in mood, such as depression, anxiety, or irritability, disinhibition, impulsivity, apathy, emotional lability, social withdrawal, or changes in judgment and insight. In addition to direct effects of the tumor, personality or behavioral changes in brain cancer patients can also be influenced by treatment-related factors such as surgery, radiation therapy, or chemotherapy. These treatments can cause side effects such as fatigue, cognitive changes, or medication-related mood disturbances, further exacerbating personality or behavioral symptoms or leading to new psychological challenges. Managing personality or behavioral changes in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neuropsychologists, psychiatrists, oncologists, and supportive care providers. Treatment strategies may include symptom management, psychotherapy, pharmacotherapy, cognitive behavioral interventions, and psychosocial support for patients and their families. Psychotherapeutic interventions aim to address specific psychological symptoms and behavioral challenges and improve coping strategies, emotional regulation, and quality of life. These interventions can help patients and their families navigate the emotional and interpersonal challenges associated with brain cancer and promote overall well-being. Overall, understanding the complex relationship between brain cancer and personality or behavioral changes is crucial for providing comprehensive care and support to patients and their families. By addressing psychological and behavioral symptoms through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 9. Fatigue, persistent fatigue or weakness that interferes with daily activities. Fatigue is a common and debilitating symptom experienced by individuals with brain cancer. The relentless exhaustion can significantly impact daily functioning and quality of life. Understanding the underlying mechanisms and potential impact of fatigue in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can cause fatigue through several mechanisms, including direct effects of the tumor on brain function, tumor-related inflammation, metabolic disturbances, and treatment-related factors. Tumors located in critical areas of the brain can disrupt neural circuits responsible for regulating sleep-wake cycles, energy metabolism, and hormone production, leading to excessive fatigue. Additionally, tumors may release substances that trigger systemic inflammation, further contributing to feelings of tiredness and lethargy. Treatment modalities such as surgery, radiation therapy, or chemotherapy can also induce fatigue as a side effect, due to their impact on healthy tissues and organs, and the body's overall energy reserves. The severity and persistence of fatigue experienced by brain cancer patients can vary depending on the tumor type, location, size, growth rate, as well as individual factors such as age, overall health, and pre-existing fatigue levels. Common manifestations of fatigue may include profound tiredness, weakness, difficulty concentrating, reduced physical and mental stamina, and impaired motivation. Managing fatigue in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, oncologists, nurses, physical therapists, occupational therapists, and supportive care providers. Treatment strategies may include symptom management, lifestyle modifications, energy conservation techniques, pharmacological interventions, and psychosocial support for patients and their families. Energy conservation techniques aim to optimize energy expenditure and enhance coping strategies for managing fatigue. These may include pacing activities, prioritizing tasks, scheduling regular rest breaks, delegating responsibilities, and engaging in relaxation techniques such as deep breathing exercises or mindfulness meditation. Physical activity and exercise programs tailored to individual abilities can also help improve energy levels, muscle strength, and overall well-being. Overall, understanding the complex relationship between brain cancer and fatigue is crucial for providing comprehensive care and support to patients and their families. By addressing fatigue through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 10. Nausea and vomiting. Nausea, vomiting, or feeling sick to your stomach, especially if it is not related to other factors such as food poisoning or gastrointestinal issues. Nausea and vomiting are distressing symptoms commonly experienced by individuals with brain cancer. These symptoms can significantly impact quality of life and may be indicative of various underlying factors related to the tumor or its treatment. Understanding the underlying mechanisms and potential impact of nausea and vomiting in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can cause nausea and vomiting through several mechanisms, including direct effects of the tumor on brain function, increased intracranial pressure, disruption of the blood-brain barrier, and treatment-related factors. Tumors located in critical areas of the brain can trigger signals that disrupt the body's normal regulatory mechanisms, leading to nausea and vomiting. Additionally, tumors may obstruct the flow of cerebrospinal fluid or compress surrounding structures, further exacerbating symptoms. Treatment modalities such as surgery, radiation therapy, or chemotherapy can also induce nausea and vomiting as side effects, due to their impact on healthy tissues and organs, and the body's overall physiological balance. The severity and frequency of nausea and vomiting experienced by brain cancer patients can vary depending on the tumor type, location, size, growth rate, as well as individual factors such as age, overall health, and susceptibility to treatment-related side effects. Common manifestations may include feelings of queasiness, stomach discomfort, retching, or involuntary expulsion of stomach contents. Managing nausea and vomiting in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, oncologists, nurses, pharmacists, and supportive care providers. Treatment strategies may include symptom management, pharmacological interventions, dietary modifications, hydration strategies, and psychosocial support for patients and their families. Antiemetic medications are commonly prescribed to alleviate nausea and vomiting in brain cancer patients. These medications work by targeting specific receptors in the brain and gastrointestinal tract to suppress nausea signals and reduce the urge to vomit. Additionally, dietary modifications such as consuming small, frequent meals, avoiding spicy or greasy foods, and staying hydrated can help alleviate symptoms. Psychosocial support, including counseling, relaxation techniques, and distraction therapies, can also play a crucial role in managing nausea and vomiting-related distress. Overall, understanding the complex relationship between brain cancer and nausea and vomiting is crucial for providing comprehensive care and support to patients and their families. By addressing these symptoms through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 11. Sensory changes. Changes in sensation, such as tingling, numbness, or burning sensations. Changes in sensation are common symptoms experienced by individuals with brain cancer. These alterations can affect various sensory modalities such as touch, temperature, pain, and proprioception, leading to significant discomfort and impairment. Understanding the underlying mechanisms and potential impact of sensory changes in brain cancer patients is crucial for providing appropriate care and support. Brain cancer can cause changes in sensation through several mechanisms, including direct compression or infiltration of areas of the brain responsible for sensory processing, disruption of neural pathways, and treatment-related factors. Tumors located in regions such as the somatosensory cortex or thalamus can interfere with the transmission of sensory information, leading to abnormalities in perception. Additionally, tumors may exert pressure on sensory nerves or cause inflammation, further exacerbating sensory disturbances. Treatment modalities such as surgery, radiation therapy, or chemotherapy can also induce sensory changes as side effects, due to their impact on nervous system function and peripheral nerves. The specific changes in sensation experienced by brain cancer patients depend on the location, size, and growth rate of the tumor, as well as individual factors such as age, overall health, and pre-existing sensory function. Common manifestations may include numbness, tingling, burning sensations, hypersensitivity to touch or temperature, and alterations in pain perception. Managing changes in sensation in brain cancer patients requires a multidisciplinary approach involving healthcare professionals such as neurologists, neurosurgeons, pain specialists, physical therapists, and occupational therapists. Treatment strategies may include symptom management, pharmacological interventions, rehabilitative therapies, and psychosocial support for patients and their families. Pharmacological interventions may include medications to alleviate neuropathic pain, such as anticonvulsants, antidepressants, or opioid analgesics. Rehabilitation therapies such as sensory retraining exercises, desensitization techniques, and assistive devices can help patients adapt to sensory changes and improve functional abilities. Psychosocial support, including counseling and education, can also play a crucial role in helping patients cope with sensory disturbances and maintain quality of life. Overall, understanding the complex relationship between brain cancer and changes in sensation is crucial for providing comprehensive care and support to patients and their families. By addressing sensory symptoms through a holistic approach that considers both tumor-related and treatment-related factors, healthcare providers can help improve outcomes and quality of life for individuals living with brain cancer. 12. Growth or changes in the head, swelling, lumps, or bumps on the head, especially if they are accompanied by other symptoms. Changes in head size are not typically associated with brain cancer itself. However, they may occur as a result of other factors related to the disease or its treatment. For instance, brain tumors can lead to increased intracranial pressure, which may manifest as symptoms like headaches, nausea, vomiting, or changes in consciousness. In cases of rapidly growing tumors or those located in critical areas of the brain, edema or swelling may occur, potentially causing an increase in head circumference. Additionally, certain treatment modalities such as surgery, radiation therapy, or chemotherapy can also impact head size indirectly by affecting fluid balance or tissue swelling in the surrounding areas. Monitoring head size changes in individuals with brain cancer is essential for assessing disease progression and treatment response. Healthcare providers may use various imaging modalities such as magnetic resonance imaging, MRI, or computed tomography, CT, scans to evaluate tumor size, edema, or other structural changes in the brain. Additionally, regular clinical assessments and symptom monitoring can help detect any signs of increased intracranial pressure or neurological deterioration that may necessitate further intervention. Management of head size changes in brain cancer patients typically focuses on addressing the underlying cause, such as tumor growth or treatment-related side effects. Treatment strategies may include surgery to remove the tumor or relieve pressure on the brain, radiation therapy to target residual tumor cells, or medications to reduce edema and control symptoms. In cases where head size changes are due to treatment-related side effects, supportive care measures such as hydration, pain management, and monitoring of fluid balance may be implemented to alleviate symptoms and optimize patient comfort. Overall, while changes in head size may not be a direct symptom of brain cancer, they can still occur as a result of underlying disease processes or treatment effects. Close monitoring and timely intervention are essential for managing these changes and ensuring optimal outcomes for individuals living with brain cancer. It's important to note that experiencing one or more of these symptoms does not necessarily mean you have brain cancer, as they can also be caused by various other conditions. However, if you notice any persistent or concerning symptoms, it's crucial to consult a healthcare professional for further evaluation and appropriate management. Early detection and treatment can significantly improve outcomes for individuals with brain cancer. What really happens to your body when you drink apple cider vinegar at night? Apple cider vinegar is one of the most effective natural remedies for improving overall health, especially when you know how to use it properly. Consuming just 2 tablespoons of this liquid before bed can rapidly stabilize your blood sugars, resulting in higher energy output the following day, a more controlled appetite for dieting, and so much more. Tonight, we're going to explore the main benefits of using this healing elixir before bed. And I'll also show you how to use it properly with the correct ingredients. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. Benefit number 1 of drinking this at night is that it regulates your blood sugars. Apple cider vinegar has been used for centuries as far back as 5000 BC because it contains acetic acid. Acetic acid helps to preserve foods and keep them fresh through the act of pickling. Modern studies, however, are now showing us that consuming apple cider vinegar with a meal or even after eating can help to regulate the glycemic response from the food by stabilizing insulin levels and helping to control blood sugars. Drinking just 2 tablespoons before you go to bed with water is an excellent way to help control your blood sugars, to not only improve your sleep, but also to improve blood sugar profile for those of you who are diabetic, pre-diabetic, or overweight. Benefit number 2 of drinking this is to prevent acid reflux. If you experience a burning sensation in your chest or your throat after eating, you may be suffering from acid reflux, where stomach acid is flicking upwards into your food pipe, causing irritation and pain. This happens when the stomach has become too alkaline, which causes this sphincter, called the LES, to remain open, allowing acid to reflux from the stomach and burn the airways inside of your esophagus. Acetic acid from the vinegar actually helps to close this sphincter in order to prevent reflux at night. What's more, drinking this also supports the release of digestive enzymes and bile, which help to lubricate the digestive system and help eliminate undigested food waste. Try taking 2 to 4 apple cider vinegar capsules before each meal, or drinking the liquid in water for 1 to 2 weeks, and notice how your symptoms improve. Benefit number 3 is naturally boosting your energy. When you drink apple cider vinegar, your body absorbs the acetic acid and converts it into ketones called acetone and butyrate. These ketones work as a fuel or an energy source for the mitochondria in your cells, particularly in your brain cells. This gives you a natural yet very powerful energy boost. In addition, unlike glucose, which is sugar, ketones from this vinegar are more easily used by your cells, and they also produce less free radical damage. So rather than relying on caffeinated drinks like coffee or tea for an energy boost, give this drink a try instead, and you will soon begin to notice higher energy output. Historically, apple cider vinegar was actually used daily by honey farmers in Vermont. And this was used to help them maintain high energy levels when working long shifts on the farm well into their old age. Very quickly, I'd be grateful if you could hit the like button, subscribe, and turn all notifications on so that I can keep you updated with my latest health and nutrition tips. Moving on to benefit number 4, which is improving hair growth. One of the main reasons that people lose their hair as they get older is due to hormonal imbalances and digestive problems. By controlling your blood sugars and also helping your stomach to digest more minerals like zinc, copper, and iodine, apple cider vinegar effectively improves the hair growth and keeps it healthy, and reduces hair loss. It can also be diluted with water and used to shampoo the hair in order to destroy harmful microbes that are causing dandruff, and it also gives the hair a wonderful shine. The next benefit of drinking apple cider vinegar before bed is stimulating weight loss. This is very important. By lowering the glycemic response when you eat carbohydrates, apple cider vinegar effectively also supports healthy weight loss. By drinking this before bed, your body is able to burn more fat whilst you sleep. You'll also notice lesser appetite the following day because the acetic acid has provided fuel to your cells. It also helps to deepen autophagy. This is cellular cleaning whilst you're asleep, to make your body more energy efficient. By effectively reducing insulin resistance, this golden elixir has provided the key to sustainable weight loss for millions of people around the world, including myself. I prefer to take it in capsules, however, but I'll discuss this more later in the video. Number 6 is fighting pathogens. As I previously mentioned, apple cider vinegar was used by the Egyptians and other ancient cultures to preserve food because it kills bacteria and prevents the food from spoiling. What's very interesting is that it can also help to prevent pathogens and harmful microbes from invading your body and making you ill. Apple cider vinegar has a pH of 2 to 3, meaning that it's very acidic, and this makes it helpful for your digestion and destroying pathogens found in the food. However, the acidity itself also stimulates white blood cell activity in your body. It speeds these white blood cells up, making them more active, so that your immune system can attack and destroy viruses, bacteria, parasites, and fungus before they can do damage. So if you find yourself under the weather, start drinking apple cider vinegar twice per day to help kill the infection in your body faster. The 7th benefit of this drink is that it can also help to build muscle. As women and men get older, especially over the age of 30, 50, the stomach acids become weaker, making it harder to digest. Protein. Amino acids, which are the building blocks of protein, are needed to keep the body strong with age and prevent it from breaking down too quickly. Drinking this particular mixture before bed or even before a meal will help your digestive system to absorb and assimilate amino acids from your food in order to keep the muscles, teeth, bones, skin, hormones, and other proteins very strong and working as they should be. What's more, this is also excellent to drink before working out as it can stimulate human growth hormone for faster and better muscle gains. Benefit number 8 is reducing pain and inflammation throughout the body. If you suffer from inflammation, regular aches, pains or arthritis, you may want to try using 2 tablespoons of apple cider vinegar, 1/4 teaspoon of turmeric powder, which is organic, and mix these in a glass of water and drink before you go to bed. This is a powerful natural pain relief remedy that's been used for centuries, and it's highly effective. Apple cider vinegar helps your body to absorb curcumin from the turmeric. This is a substance that's been shown in hundreds of studies to reduce inflammation throughout the body. Drinking this mixture also helps to clean out fatty deposits from your liver, boosting GT1, which is the master antioxidant, and it also effectively helps strip away unwanted visceral body fat from around your organs, which may be causing some of your inflammation. Benefit number 9 is improving the quality of the skin. If you notice that your skin is very dull, unhealthy, or rough and lacking luster in appearance, this drink may help to improve it. Firstly, I recommend that you start consuming more foods that are rich in retinol. This is the active form of vitamin A found in pasture-raised eggs, grass-fed beef liver, and oily fish like salmon, sardines, and mackerel. Drinking just 2 tablespoons of apple cider vinegar per day will help your body absorb the retinol from these foods in order to improve the quality of your skin. Additionally, apple cider vinegar itself is also high in pectin. This is a polysaccharide which can improve the health of the skin's natural barrier. And point number 10, which is probably the most important of all, is that it improves gut and brain health. Drinking 2 tablespoons of apple cider vinegar on a daily or evening basis supplies ketones that help to heal the tight junctions in your gut. This helps to prevent toxins from leaking through your intestinal barrier in order to reduce inflammation and prevent autoimmune diseases like arthritis. Apple cider vinegar helps to improve the production of brain-derived neurotrophic factor, or BDNF, which improves the connection between your brain cells, and this plays a significant role in preventing depression and other mood disorders. In fact, many chemicals that are used by your central nervous system are actually produced in your gut. So, By improving the gut health with apple cider vinegar, you can boost serotonin, GABA, dopamine, and acetylcholine. These all can effectively improve your memory, your concentration, your calmness, focus, and your ability to learn new information. Different ways to use apple cider vinegar. I recommend mixing 2 tablespoons of organic, unpasteurized, and undiluted apple cider vinegar in 16 ounces of water and drink this with a straw before you go to bed. Alternatively, you can do this before a meal to support better digestion. You may also add 1/4 teaspoon of turmeric powder if you want to reduce pain and inflammation, and this is optional. Make sure that you do check the ingredients list, and ensure that your chosen brand has not been diluted with water, as this will definitely weaken its effects. I recommend drinking this mixture with a straw, as the acid may be good for your stomach, but it can be a little too strong for your mouth and your teeth. Alternatively, you can make a tasty salad vinaigrette dressing by mixing 1/4 cup of apple cider vinegar with 1/3 a cup of extra virgin olive oil and 1/4 of a teaspoon of turmeric. Pouring this over your daily salad. Another way is to marinate your meats with a little apple cider vinegar, chili, salt, pepper, rosemary, thyme, and some of your other favorite spices to get this into your diet and also to tenderize meat. On a final note, if you suffer from indigestion and heartburn, I do recommend drinking this before a meal, as it will help to digest and break down the food better. Alternatively, if you don't like this, you may like to try my ginger and lemon water remedy for some similar health benefits. So go ahead and tap on this video that's on your screen now for that information. Otherwise, thank you so much for watching this video today, and as always, I wish you great health, wealth, and happiness. The 6 amazing health benefits of drinking ginger and lemon water daily. Ginger root is a powerful medicinal spice, and it's been used for over 5,000 years in India and China for its healing properties, and it's still used today for its unique and delicious flavor. Likewise, lemon juice is also known to help purify the body, including the blood and the digestive system, as it's rich in antioxidants and citric acid. When you combine fresh ginger juice with fresh lemon juice, you create a powerful health tonic that can strengthen your body against all different kinds of ailments and diseases, especially when it comes to detoxifying harmful substances from your body and lowering your body fat percentage. Before we dive into the 6 amazing benefits of these ingredients, let's take a look at the recipe. You will need a 4-inch slice of fresh ginger, 1 whole lemon or 2 limes, and 500 milliliters of mineral water. Method: use a cheese grater to shred your ginger very finely, or you can use a sharp knife. There's no need to remove the skin for this recipe. Now add the shredded ginger into the water, stir it well and refrigerate for 1–2 hours, allowing the ginger juice to fully infuse into the water. Then strain the mixture using a cheesecloth to remove the ginger fiber, leaving you with just the pure ginger water. Then simply squeeze the juice from the whole lemon into the ginger water. Drink this mixture on an empty stomach once a day to begin experiencing some major improvements in your health. I'll talk more about these benefits in the next section. Please note, make sure that you do not use hot or warm water for this recipe. Heating the water can destroy some of the delicate antioxidants, and we need these, so stick with cold water and be patient with this recipe. I also recommend using only fresh lemon juice, as the bottled varieties tend to be pasteurized and they lack the real vitamin C and antioxidants that we're looking for here. Finally, feel free to make a larger batch of this to store up to 3 to 4 days in the refrigerator. But as with all of these healing remedies that I talk about, try to remember that the fresher it is, the better it is. Now let's explore the 6 amazing health benefits of drinking this tonic on a daily basis. Just a quick reminder, this video is for educational purposes only, so do speak to a doctor if you have any genuine medical concerns. The first benefit, of course, is digestion. Drinking this mixture on an empty stomach helps to clean out the digestive system so that you can absorb more nutrients from your food that you consume later in the day. This tonic is actually excellent for those who suffer with bloating, gas, indigestion, acid reflux, GERD, and other digestive problems. You see, the ginger in this drink helps to improve liver function by boosting glutathione. This is the master antioxidant. Your liver then starts releasing more concentrated bile, a liquid that cleans out your intestines, helps to carry away waste through your colon, and detoxifies harmful substances from your body. Likewise, the citric acid from the lemons helps your natural stomach acids to break down food better, allowing you to absorb more vitamins and minerals, such as vitamin A, E, zinc, iron, calcium, etc. This drink is very helpful for those with anemia, as the vitamin C helps your body to absorb more iron to make red blood cells or hemoglobin. Citric acid can also help to prevent the formation of kidney stones, because it binds to calcium oxalates, preventing them from crystallizing in your kidneys. The second benefit is increased blood circulation. Ginger and lemon water is also one of the best remedies for boosting the circulation of the blood around your body. The ginger rolls that give it the spicy zing that you taste helps to block certain enzymes that are making your arteries narrow and tight. So drinking this helps the arteries to become more flexible, allowing for better blood flow and lowering your blood pressure. This can naturally improve the health of your heart, lowering the risk of heart attacks, strokes, and blood clots, as more oxygen travels through your body. In addition, the lemon juice also provides vitamin C, hesperidin, and diosmin. All of these ingredients help to strengthen the blood vessels and prevent cholesterol from oxidizing and sticking to the walls of your arteries. If you're finding this information helpful, please hit the like, subscribe, and turn all notifications on for my latest health and nutrition tips. Coming right back now to benefit number 3, reduced pain and inflammation. Another interesting fact is that ginger juice has been scientifically shown to be stronger than some over-the-counter pain relief drugs like acetaminophen or ibuprofen, but without the side effects, as it's completely natural and unprocessed. So, when you combine this with the anti-inflammatory properties of the lemon juice, you get a powerhouse natural pain relief tonic. After drinking this for a few days, you'll notice less aches and pains, especially in your joints and your muscles because of the increased blood flow. The drink will also reduce swelling and inflammation by helping your body to flush out excess fluids that could be backing up into your tissues and triggering pain. This drink is actually one of the most powerful menstrual pain remedies for women who suffer with heavy periods. It works by lowering prostaglandins in the same way that ibuprofen would. So, if you suffer with any type of arthritis, chronic pain, or headaches, try this mixture out for a week and see how you feel. Number 4 is a boosted immune system. As I previously talked about, ginger has been used for thousands of years for treating cold and flu, and it's very effective at speeding up the life cycle of an infection. For example, if you have a cough, a sinus infection, a cold, or a virus, you can double the dose of this drink and drink it twice per day. The powerful antioxidants, plant compounds, and vitamins found in both the lemon juice and the ginger help to speed up the immune cells in your body. The immune cells, also known as white blood cells, then start attacking the harmful invaders, like the viruses or the bacteria in your body faster, so that you can heal at a rapid rate. Before the birth of modern medicine, These remedies were absolutely necessary in ancient cultures to help fight off disease. Benefit number 5 is anti-cancer. Studies have also shown that consuming ginger on a regular basis helps to induce autophagy. This is basically a process where your body cleans out damaged cells and proteins and recycles them into new healthy cells. This will reduce the risk of cells becoming cancerous. And as this drink also boosts antioxidants in your body, it further protects the genetic material called DNA in your cells from free radical damage. In fact, the gingerols, shogal, and peridols from the ginger, along with the citrus juice from the lemon, has all been shown to cause existing cancer cells to commit suicide without harming any of the healthy cells around them. And the 6th benefit is weight loss. If you're looking to lose weight, it's important that you focus on lowering the fat storage hormone in your body, which is called insulin. You can do this by following a low-carb diet, fasting, eating less frequently, and also getting more antioxidant foods into your diet. The antioxidant effect of ginger and lemon juice helps to lower the need for insulin in your body by improving insulin sensitivity. Therefore, basically drinking this mixture helps more energy to get into your cells, naturally lowering your hunger and helping your body to tap into its fat stores for energy. By reducing insulin resistance, this drink can also help to prevent or manage type 2 diabetes. Bonus benefits: in addition to the 6 key benefits that we've just talked about, you may also notice some other changes when you drink this regularly. Ginger juice, for example, is one of the best nausea remedies and can naturally prevent morning sickness, travel sickness, motion sickness, and a general feeling of nausea because of how it improves the flow of digestive juices. The lemon water also works with the ginger to improve the breakdown of toxins in your liver. We call this stage 1 and stage 2 detoxification. This naturally has an anti-aging effect on your body because your liver starts producing more glutathione and antioxidants that will protect the trillions of cells from free radical damage and oxidation as you age. In addition, the drink also contains trace amounts of copper and lots of the real vitamin C complex, which boosts collagen synthesis. This will make your skin look healthier, younger, and smoother, and it will strengthen the ligaments, tendons, and the cartilage in your joints. When you drink this mixture, you may notice that it has a warming effect in your stomach. This is caused by the zingiberine and the gingerols from the ginger, and it's very normal and a sign that it's fresh and working properly. Other ways to use ginger and lemon. If you're in a hurry, you may not always have time to produce a fresh batch of ginger and lemon juice, so try adding these into your diet in different ways. You could try adding ginger powder to your stir-fries, soups, marinades, and curries for a quick hit of flavor and health benefits. You could also squeeze raw lemon juice using your hands over a salad to help you absorb more minerals and digest the vegetables better. I also recommend taking ginger capsules on a long journey if you have travel sickness. My wife uses these, and they are very effective. Use ginger essential oils directly on aching joints and muscles, as the warming effect can help to decrease pain beneath the skin. Or you can use an electric juicer to make a ginger shot with a quick squeeze of lemon if you can tolerate the strong kick without the added water. Remember that these natural remedies always work best when you're following a healthy lifestyle. Style that's low in processed foods and high in whole fruits, vegetables, meats, and fish. Eating refined foods like sugar, flour, and vegetable oils will all cause massive amounts of inflammation and will block you from getting healthy. So if you'd like to learn more about the healthiest foods that you can eat with no carbs and no sugars, go ahead and tap on this video on the screen now. Thank you so much for watching my video today, and as always I wish you great health, wealth, and happiness. The top 6 foods that cause belly fat to accumulate. Belly fat forms when your liver contains too much fat and there's not enough room, so it starts to spill over and wrap itself around your organs. This is what we call visceral fat, which can be very dangerous because it obstructs the function of your organs, like your heart, your pancreas, intestines, and your gallbladder, for example. The more belly fat that you have, the higher risk of developing high blood pressure, diabetes, heart disease, circulation problems, and also swelling throughout your body. The visceral fat beneath your belly is also biologically active and it releases cytokines that cause inflammation. This damages the cells in your body, causing insulin resistance, making it harder to lose weight in the future. Belly fat is usually caused by a high-carb diet, where you're eating too many foods that contain sugar, starch, or fructose. It can also be triggered by inflammatory foods that damage the liver, which causes a spillover of fat. And also, high levels of cortisol, the stress hormone, also produces more visceral and subcutaneous fat around your belly. In today's video, you're going to be learning about the worst 6 foods that cause visceral belly fat so that you can start cutting them out of your diet. I'll also explain how stress causes belly fat and the steps that you can take to fix it. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. The first item on my list is trans fats. Some of the most dangerous foods that cause a buildup of belly fat are hydrogenated oils like soybean oil, corn, canola, cottonseed, sunflower oils, and margarine. These cheap and inexpensive fats are often used to cook fast foods, takeout meals, and they're also in 80% of the packaged foods found in supermarkets. Just check the labels and you'll see them. Despite being called vegetable oils, they are actually made from highly processed grains, which involves using solvents and chemicals that are toxic to your liver cells. These oils are also rich in omega-6 fatty acids, which raises inflammation throughout your body, causing a buildup of fat in your liver, which then spills over into your belly. So you want to start avoiding these junk foods and cook your own healthy meals at home. I recommend using cold-pressed healthy oil alternatives like avocado oil, extra virgin olive oil, and grass-fed butter. The second food to avoid is grains and flour. Starchy foods like bread, cereal, biscuits, pasta, crackers, pastries, and donuts are all loaded with refined carbohydrates. As these are very high on the glycemic index, they quickly turn into sugar called glucose in your blood. As you now have too much sugar floating around, any extra sugar is converted into fat. Fat and stored in your fat cells, and as visceral fat beneath your belly. Whole grains also contain phytic acid, which can block your body's ability to absorb minerals like zinc, magnesium, and calcium. So if you want to lose your belly fat, I recommend following a low-carb diet plan such as keto, as this will help to lower the blood sugars so that you can burn through your fat stores for energy. Number may third surprise you. It's fructose. Fructose is a type of sugar found in fruit. It's 50% of table sugar and it's also part of agave nectar and high fructose corn syrup. The problem is that your cells do not use fructose as energy like they would regular glucose. The fructose is directly broken down in your liver, and as 80% of packaged foods contain high fructose corn syrup, this overwhelms your liver and causes a buildup of visceral fat, liver damage, and insulin resistance. Fructose actually has the same damaging effect on your liver as alcohol does, as it's metabolized in the same way. If you start checking labels, you'll find it in soda drinks, fruit juices, jams, syrups, sweets, and all different kinds of junk foods. High fructose corn syrup is also made from genetically modified corn, which is sprayed with chemical herbicides. So it also has harmful chemicals that further damage your liver, which leads to belly fat. You definitely want to avoid these foods and switch to snacks that contain healthy sweeteners and alternatives like erythritol, stevia, and monk fruit. If you're finding this information helpful so far, please tap the like, subscribe and turn all notifications on to stay updated with my latest health and nutrition tips. Let's jump right back in now with number 4, which is soy protein. Soy protein isolates are some of the worst food additives that you could possibly put into your body. These are highly processed, inexpensive plant proteins that are extracted from GMO soybeans grown with heavy amounts of glyphosate, a dangerous herbicide that's toxic for your liver. Soy protein isolates are used to make so-called protein bars, diet shakes, ready meals, fake vegetarian meat patties, and it's even in some baby milk formulas. Soy is actually one of the leading causes of hormonal imbalances in both women and men, causing inflammation in the liver and weight gain around the viscera. Avoid these highly processed proteins and stick with whole food proteins instead from meats, eggs, fish, shellfish, or if you're a vegan, you can use water lentils. Number 5 is soda drinks, both regular and diet. I already mentioned that soda drinks are sweetened with both glucose and fructose, which turns into fat around your stomach. But even the diet drinks cause you to accumulate fat indirectly, as they contain artificial sweeteners like aspartame and sucralose. These synthetic sweeteners can cross the blood-brain barrier, blocking certain neurotransmitters that tell you when you're full. This gives you cravings and makes you feel extremely hungry, making you more likely to snack or purchase more junk foods. In fact, the artificial sweeteners have been shown to kill friendly microbes that live in your gut. This can cause liver damage, weight gain, and also depression and anxiety. So cut out the soda drinks and switch to some healthy alternatives. I personally recommend taking some carbonated water and adding a few mashed berries and a little stevia to make a healthy soda drink without the sugar or the chemicals. And last but not least, let's talk about alcohol. If you drink alcoholic drinks on a regular basis, you're far more likely to develop both visceral and subcutaneous fat around your belly. You see, alcohol puts a very heavy burden on your liver. As it's a solvent, the liver has to break it down into small particles in order to detoxify it. Over time, this strain damages the hepatocytes, which are your liver cells. This causes inflammation and lowers your body's ability to metabolize fat and sugar properly. This causes fatty liver disease, and fat then starts to build up inside the organ until there's no longer any space, so it starts spilling over into spaces between your organs, pushing your belly outward. Alcohol also has to be burned off before the liver can burn other fuels. So if you're drinking alcohol, eating fructose, sugar, and grains, it reaches a point where it can no longer process all this fuel, and it starts leaking fluid that makes your belly even bigger. If you do have a protruding belly, you definitely want to clean up your diet, as this massively raises the risk of diabetes, heart attacks, and liver cancer later in your life. How stress causes belly fat. Now that you're aware of the foods that you should be avoiding if you want to burn or prevent belly fat, it's important to understand how stress can also trigger the accumulation of belly fat. You see, when you're anxious, stressed, or fearful, your glands release a hormone called cortisol. This is also known as the stress hormone. This hormone quickly starts turning proteins in your body into sugar, so that you can have a quick burst of energy to run away or fight in an emergency situation. Historically, this would have been a fear response to escaping a predator like a lion or a tiger, for example. However, the body isn't designed to experience long-term mental stress that we create for ourselves from relationships, life situations, and financial concerns, for example. Over time, if you stay stressed and you keep producing more and more cortisol, your body continues to raise the sugar in your blood. This then triggers another hormone called insulin, which goes in to remove the excess sugar and turns it into body fat, which tends to accumulate around your stomach. So if you're eating well and you're still not losing weight, you'll need to find ways to turn off this cortisol and reduce the stressful situations in your life. I personally recommend walking in nature for at least 45 minutes each day with lots of fresh air and sunshine. The oxygen in the space will help to calm down your nervous system and turn off this fight or flight response that's making you gain weight. Studies also show that listening to slow and calm music that is around 60 beats per minute has a relaxing effect on the body, helping to ease stress and lower your cortisol. I also recommend using guided meditations, which are freely available online. Finally, make sure that you're getting at least 8 hours of sleep, as this is undoubtedly the best way to manage stress, as your hormones tend to rebalance and reset during REM sleep. Sleeping also helps to raise glucagon, the hormone that helps you burn more fat. I hope you found this useful. To learn about the top 12 belly fat burning foods, go ahead and tap on this video on the screen now. Thank you so much for watching my video today, and as always I wish you great health, wealth, and happiness. The health benefits of turmeric and apple cider vinegar, and a simple recipe to use at home. 1. Apple cider vinegar was used by the ancient Egyptians as a natural medicine and antiseptic at least 8,000 years ago. It was recommended and prescribed in ancient Greece as a healing elixir. 2. Turmeric was also used by ancient civilizations as a spice, commonly added to delicious curries in Asian cuisine. This is still used today to treat many medical problems and ailments. 3. When these ingredients are mixed together, they form a unique remedy which has some tremendous health benefits. These work wonders in lowering inflammation throughout the body, especially for those with arthritis. 4. Turmeric contains a powerful compound called curcumin. This has been scientifically shown to be stronger than medical drugs for fighting diseases and infections. Apple cider vinegar works hand in hand with the turmeric by introducing its powerful acetic acid and enzymes. These rapidly boost your body's digestion, allowing you to break down foods and absorb more nutrients from every meal. Recipe: you will need 250 milliliters warm water, 1 tablespoon apple cider vinegar, 1 teaspoon turmeric powder, 1 teaspoon ground black pepper. Method 1. Mix the ingredients together in a glass and stir well. Drink this on an empty stomach every morning before breakfast. It is very important that you use raw, unfiltered apple cider vinegar, as this contains the proteins and enzymes that the body needs. The black pepper contains piperine, which will help your body to absorb curcumin and other compounds from within the turmeric. If you do not like the taste, simply add a little raw honey or xylitol for sweetness. 6. The acetic acid and curcumin work together to trigger weight loss in the body. These ingredients reduce fat storage, especially in the belly area. They help you to tap into your own fat reserves for energy. 7. Drinking this every day is excellent for those who suffer with depression, as it has been shown to be stronger than Prozac, yet is completely natural. It does this by boosting serotonin and dopamine neurotransmitters in the brain. Drinking 8. Studies have shown that curcumin in turmeric is an extremely powerful natural cancer fighter. It does this by boosting communication between the cells and over 100 molecular pathways. 9. Apple cider vinegar and turmeric is also highly anti-inflammatory and is stronger than aspirin and ibuprofen. This lowers the risk of high cholesterol and stomach ulcers. 10. The turmeric works to reduce arthritis pain, whilst the vinegar helps your body to absorb new minerals and strengthen the joints, bones and connective tissues. 11. Many athletes use both of these ingredients to improve the health of their cells and mitochondria. This allows them to store more energy for better performance, strength, and stamina. 12. After drinking this for over a week, you may notice that you begin to think more clearly. It improves the health of the central nervous system and can enhance memory and recall. 13. The drink improves your body's ability to absorb nutrients from foods that you eat for the rest of the day. Eating healthy cruciferous vegetables alongside this drink gets the vitamins into your cells fast. 14. If you have swelling in the legs or feet, then today's remedy can help. It reduces the buildup of unwanted fluids which could be causing pressure in the muscles and joints. 15. Many people in Eastern countries use turmeric regularly. This combined with their healthy lifestyle helps them to stay looking younger for longer, because they have less oxidative stress in their bodies. 16. If you prefer, you can purchase a curcumin and apple cider vinegar supplement, which also contains black pepper to boost absorption. These are easier to take on the go, but the fresh variety is always best. 17. The drink contains healthy doses of calcium, iron, potassium, magnesium, phosphorus, niacin, B1, B2, B6 and C. These minerals and vitamins improve the health of the millions of cells within the body. 18. The black pepper in today's drink contains piperine. This compound is used as a natural antihistamine for those who suffer with allergies such as hay fever, hives, or allergic rhinitis. 19. Turmeric can help to improve blood pressure levels due to its anti-inflammatory properties. 20. Apple cider vinegar helps to destroy harmful pathogens found in foods, particularly in seafoods. It can also be added to a little olive oil to make a healthy salad dressing. 21. The mixture of turmeric and apple cider vinegar also detoxifies the liver and flushes out waste from the digestive system. This can be helpful when quitting drinking, smoking, or other addictive substances. 22. A healthy substance called lipolysaccharide in turmeric boosts the body's immune system against fungal, virus, and bacterial agents. 23. Some of the strongest compounds in turmeric are not easily absorbed by the body, such as curcumin. This is why it is extremely important to add the black pepper. This boosts the bioavailability of curcumin by 2000%. 24. If you suffer with acid reflux or a painful burning sensation in the chest, then you may be suffering with indigestion. This happens when the stomach struggles to break down foods because it is too alkaline or has a high pH. The apple cider vinegar and turmeric drinks strengthen stomach acid, bringing the pH down to its natural levels. The stomach then breaks down foods properly, relieving heartburn, acid reflux, and indigestion pain. The minerals and nutrients from your foods become absorbed properly, and your overall health increases. 25. The high amount of potassium from turmeric and black pepper is also excellent for reducing insulin resistance, helping to prevent diabetes. 26. After drinking today's mixture for a week or more, you may notice the skin becoming clearer, brighter, and healthier looking. Healthy skin is a positive indicator of your internal health. To learn more about natural remedies and healthy tonics such as this, please see our other videos. Thank you very much for listening. A like is always appreciated, and remember to subscribe and tap the bell for more healthy videos. I wish you great health, wealth, and happiness. Okra, commonly known as lady's fingers, offers several health benefits, including positive effects on brain health. Rich in essential nutrients such as vitamin K, folate, and antioxidants, okra plays a significant role in supporting cognitive function and overall brain health. Vitamin K, in particular, is essential for brain health as it helps in the synthesis of sphingolipids, a type of fat that is crucial for maintaining the integrity of brain cells and supporting communication between neurons. Additionally, folate, also known as vitamin B9, is necessary for the production of neurotransmitters like serotonin, dopamine, and norepinephrine, which regulate mood, memory, and cognitive function. The antioxidants present in okra help protect brain cells from oxidative stress and inflammation, reducing the risk of age-related cognitive decline and neurodegenerative diseases such as Alzheimer's and Parkinson's. Incorporating okra into your diet can therefore have profound effects on brain health, promoting sharper cognition, better memory, and overall cognitive well-being. A study published in the Journal of Nutritional Neuroscience found that okra extract exhibits neuroprotective properties by reducing oxidative stress and inflammation in the brain. The antioxidants present in okra, such as vitamin C and polyphenols, were shown to scavenge free radicals and prevent neuronal damage, thus preserving cognitive function and reducing the risk of neurodegenerative diseases. Another study published in the Journal of Alzheimer's Disease demonstrated that okra extract inhibits the formation of beta-amyloid plaques, which are characteristic of Alzheimer's disease, and promotes the clearance of these harmful protein aggregates from the brain. Additionally, research published in the journal Nutritional Neuroscience suggests that the vitamin K content in okra plays a crucial role in maintaining brain health by supporting the synthesis of sphingolipids, a type of fat that is essential for brain cell structure and function. These scientific findings provide compelling evidence for the neuroprotective effects of okra and underscore its potential as a dietary intervention for preserving brain health and preventing cognitive decline. Okra, attention for its potential role in cancer prevention and treatment. Rich in antioxidants, vitamins, and minerals, okra possesses properties that may help inhibit the growth and spread of cancer cells. The high levels of antioxidants found in okra, including vitamin C and polyphenols, help neutralize free radicals and reduce oxidative stress, which is known to contribute to cancer development. Additionally, okra contains compounds such as quercetin and catechins, which have been shown to have anti-cancer effects by inducing apoptosis, programmed cell death, in cancer cells and inhibiting tumor growth. Furthermore, the high fiber content of okra can help promote digestive health and reduce the risk of colon cancer by promoting regular bowel movements and preventing constipation. While more research is needed to fully understand the potential anti-cancer effects of okra, incorporating this nutritious vegetable into your diet as part of a balanced and healthy lifestyle may help reduce the risk of cancer and support overall well-being. Scientific research has investigated the potential anti-cancer effects of okra, providing promising evidence of its efficacy in cancer prevention and treatment. A study published in the journal Molecular Nutrition and Food Research demonstrated that okra extract inhibited the proliferation of human breast cancer cells in vitro by inducing apoptosis, programmed cell death, and suppressing tumor growth. The study attributed these anti-cancer effects to the presence of bioactive compounds such as quercetin and catechins in okra, which exhibit cytotoxic activity against cancer cells. Furthermore, research published in the Journal of Agricultural and Food Chemistry highlighted the anti-cancer properties of okra polysaccharides, showing that these compounds inhibited the growth and metastasis of colon cancer cells in mice. Okra polysaccharides were found to exert their anti-cancer effects by modulating immune responses and suppressing angiogenesis, the formation of new blood vessels that supply tumors. Additionally, epidemiological studies have suggested a potential link between dietary consumption of okra and a reduced risk of certain cancers, including colorectal cancer and ovarian cancer. These scientific findings provide compelling evidence for the anti-cancer effects of okra and underscore its potential as a dietary intervention for cancer prevention and adjunctive therapy alongside conventional treatments. In addition, okra also has other effects such as supports heart health. The soluble fiber in okra helps lower cholesterol levels, reducing the risk of heart disease and stroke. Regulates blood sugar. Okra contains soluble fiber and other compounds that help stabilize blood sugar levels, making it beneficial for individuals with diabetes or those at risk of developing the condition. Promotes weight loss. With its low calorie and high fiber content, okra can help you feel full for longer periods, reducing overall calorie intake and supporting weight loss efforts. Boosts immunity. Okra is rich in antioxidants, including vitamin C and polyphenols, which help strengthen the immune system and protect against oxidative stress and inflammation. Supports bone health. Okra is a good source of vitamin K, which is essential for bone health and helps improve bone density, reducing the risk of osteoporosis. Improves digestive health. The mucilage content in okra acts as a natural lubricant for the digestive tract, soothing irritation and promoting the healing of ulcers and other digestive disorders. Aids in detoxification. Okra contains compounds that support liver function and help detoxify the body by removing harmful toxins and waste products. Anti-inflammatory properties. Okra is rich in flavonoids and other bioactive compounds that have anti-inflammatory effects, reducing the risk of chronic diseases such as arthritis and inflammatory bowel disease. Supports eye health. Okra contains nutrients like vitamin A, lutein, and zeaxanthin, which promote eye health and reduce the risk of age-related macular degeneration and cataracts. Improves skin health. The antioxidants in okra help protect the skin from damage caused by free radicals, reducing the signs of aging and promoting a healthy, radiant complexion. Balances hormones. Okra contains compounds that help regulate hormone levels in the body, promoting hormonal balance and reducing the risk of hormonal imbalances and associated conditions. Incorporating okra into your diet can provide a wide range of health benefits, making it a truly miraculous food for your body. So how to cook okra without harming your health? When preparing okra, it's best to opt for cooking methods such as steaming, boiling, or roasting, as these methods help retain the vegetable's nutrients. However, frying okra in excessive amounts of oil is not recommended due to scientific evidence indicating potential adverse effects on health. When okra is fried, it absorbs the oil, resulting in a significant increase in its calorie and fat content. A study published in the journal Food Chemistry investigated the impact of frying on the nutritional composition of okra and found that deep frying significantly increased its fat content, particularly saturated fats, which are associated with an increased risk of heart disease and other health problems. Furthermore, excessive consumption of fried foods has been linked to weight gain, obesity, and metabolic disorders such as type 2 diabetes and high blood pressure. Another study published in the American Journal of Clinical Nutrition found that a high intake of fried foods was associated with an increased risk of cardiovascular disease and mortality. Therefore, it is advisable to limit the consumption of fried okra and opt for healthier cooking methods such as baking, grilling, or steaming to reduce calorie and fat intake and promote overall health and well-being. Additionally, cooking okra for too long can have negative effects on its nutritional value and texture. Scientific research has shown that prolonged cooking can lead to a loss of water-soluble vitamins and antioxidants in okra. A study published in the Journal of Food Science and Technology found that overcooking okra resulted in a significant reduction in vitamin C content, which is a key antioxidant that helps protect cells from damage caused by free radicals. Additionally, prolonged cooking can cause okra to become mushy and slimy, making it less appetizing to eat. Another study published in the Journal of Agricultural and Food Chemistry found that overcooking okra led to changes in its texture and color, as well as a decrease in its overall nutritional value. Therefore, it is important to cook okra just until tender to preserve its nutritional content and texture, and to avoid overcooking it to maintain its health benefits. Furthermore, eating raw okra is not recommended due to potential health risks associated with its consumption. Okra contains certain compounds, such as lectins and phytic acid, that may be harmful when consumed in their raw form. Lectins are proteins found in many plants that can interfere with nutrient absorption and cause digestive issues. Phytic acid, on the other hand, is an anti-nutrient that can bind to minerals like calcium, magnesium, and zinc, reducing their absorption in the body. Furthermore, raw okra may contain harmful bacteria, parasites, or pesticides that can cause foodborne illnesses or other health problems. According to a study published in the Journal of Food Protection, raw okra samples were found to harbor potentially pathogenic bacteria such as Escherichia coli and Salmonella. Cooking okra properly helps to neutralize these harmful compounds and kill any pathogens present, making it safer to consume. Therefore, it is advisable to cook okra before eating it to reduce the risk of digestive discomfort, nutrient malabsorption, and foodborne illness. And when it comes to combining foods, there are certain combinations that may not be ideal for digestion or overall health. One such example is combining okra with certain dairy products like milk or yogurt due to scientific evidence suggesting potential adverse effects on health. Okra contains high levels of oxalates, compounds that can bind to calcium in the digestive tract, forming insoluble calcium oxalate crystals. A study published in the journal Food Chemistry investigated the oxalate content of various vegetables, including okra, and found that okra contains significant levels of oxalates. When consumed with dairy products rich in calcium, such as milk or yogurt, the oxalates in okra may interfere with the absorption of calcium, leading to reduced calcium bioavailability. This can potentially contribute to calcium deficiency over time, increasing the risk of osteoporosis and other bone-related disorders. Furthermore, excessive consumption of oxalates can also increase the risk of kidney stone formation in susceptible individuals. Therefore, it is advisable to avoid combining okra with dairy products to optimize calcium absorption and support overall health. Combining okra with foods rich in protein, such as meat or eggs, is not recommended due to potential digestive issues and impaired nutrient absorption. Okra contains mucilage, a gel-like substance that can slow down digestion and delay the absorption of nutrients in the stomach and intestines. Additionally, protein-rich foods require different digestive enzymes and conditions for optimal digestion compared to vegetables like okra. A study published in the journal Nutrients investigated the effects of combining protein-rich foods with high-fiber vegetables on digestion and found that such combinations can lead to digestive discomfort, bloating, and gas due to differences in digestion rates and enzyme requirements. Furthermore, the presence of mucilage in okra may further slow down the digestion of protein, potentially leading to fermentation in the gut and the production of gas. Therefore, it is advisable to consume okra separately from protein-rich foods to support optimal digestion and nutrient absorption, as well as to minimize the risk of gastrointestinal discomfort. Overall, enjoying okra in moderation and prepared using healthy cooking methods ensures that you reap its nutritional rewards while avoiding any potential drawbacks.